Hi guys, and welcome to another edition of Anatomy Corner. Slightly different protocol for today. We've had some questions coming in via our members only area on our Glut Medius Explained tutorial. Now inside our members area we have Glut Medius Explained, which takes you through how to assess and rehab glut medius dysfunction. We've had a really great question, really insightful question from one of our members asking about the implications of when there is glut medius dysfunction when somebody has low back pain. So just to give you some background, her question is specifically to when people have back pain and they start walking very square. So we lose our normal gait flow and we tend to walk very square and slightly flexed through the hips because we're bracing for pain. Patients are expecting pain, so they lose that gait flow, and the role that glut medius has in that process. Now her question is pertaining to glut minimus and what happens to glut minimus when this happens, and why as a secondary hip flexor it tends to fire. Now that all comes down to the anatomy at the end of the day, which is why we're posting this here in Anatomy Corner. So if we think about the insertion of glut medius, it being very lateral into the hip, versus glut minimus tends to wrap around and insert more anteriorly, which is why if we are square and slightly flexed down, it will be those, obviously the primary hip flexors, but that secondary hip flexor of glut medius that will tend to fire up as soon as we go into that square stiff gait when we have low back pain. So I hope that answers the first part of your question. The second part of your question was comparing that. So when we have a square stiff low back versus somebody that's limping. So in our Glut Medius Explained tutorial we talk a lot about the dysfunction that happens within the gait cycle when we have a lower limb injury or a low back problem such as sciatica that makes us begin to limp. So again, it comes down to the anatomy. So if we're thinking about that lateral insertion of glut medius and its function with respect to lateral stability of the hips, if we are limping and shortening our gait cycle on one leg, again, that gives way to that squareness. But the exception of that will be if we've got a swinging limp, which is a little bit less typical, but if they're really hitching up through their pelvis as a result of that lower limb injury, where you can see how that movement of that hitching up movement is going to be really putting a lot of pressure on the non-symptomatic glut medius. So slightly different implications for what glut medius is up to, and lesser so with that limping, that lateral listy limp for glut minimus and its secondary hip flexor role. However, if they are tending to limp and really lift that leg and shorten down, so there's lots of different limping patterns, but that certainly would imply more firing of that glut minimus. So to answer your question, it isn't just simply as straightforward as the glut minimus firing up because glut medius isn't doing its job. It is a little more complex than that, and I hope that makes it a lot clearer for you. Any other questions, don't hesitate to get in contact, guys. Alright, see you next time.